Welcome to Founders and Fortunes, where we dive into emerging founders, family offices, and the deal flow shaping private markets. On this episode, I'm joined by Dr. Brian Dooreck, a practicing gastroenterologist and the founder of Executive Health Navigation, a trusted health advisor for some of the world's wealthiest families and the multifamily offices that serve them. What started as a side pursuit in South Florida has become a doctor-facing, high-trust healthcare navigation platform designed for when stakes are high and time is short. In this conversation, Brian opens up about how human connection has become the new capital, why he's not scaling for an exit, and what most advisors, founders, and family offices miss about the realities of the healthcare system and their own blind spots. It's equal parts founder journey, hard-earned clinical wisdom, and a timely reminder of what truly matters most when winter is coming. Let's get into it. Brian, thank you so much for joining us today.
My pleasure. Happy to be here and glad we got time and glad I'm able to find time. So let's rock and roll. Let's jump into this.
Hey, let's do it. So first question, when someone asks you what you do, how do you answer? What do you tell them?
I think, recently I came clear, when you ask two questions, what business are you in and what business are you really in? I only recently kind of really started looking at it and started sharing it a little bit more forward. I know what business we're in. That's very clear. We are in the business of helping individuals and households move through a very challenging healthcare system with a very high degree of privacy and discretion in a doctor-facing model that helps people navigate through challenging times knowing they're not alone. That's the business we're in. If you ask me what business we're really in, we're in the business of helping multifamily offices and ultra high net worth advisors make more money. And I have not really been focused on sharing that till recently in my conversations with the firm-based relationships we have. And I could talk to you more about it and what that is. But truthfully, there's a reason why we've been called healthcare problem solvers. We are professional healthcare problem solvers. Why we've been called medical sherpas. There's a reason why I left my private practice and partnership in South Florida last November, about a year ago, literally to the date, to give this business the now time and attention it requires. Because Ryan, today the world's changing. You're younger than me. I'm 54. You've seen a different world than I have. I've seen different things than you have. But today the world is changing clearly. And a blind man in the dark knows healthcare is a broken, challenging system. It is a corporate mess of big farm, big industry, big insurance, big hospitals, for-profit, not-for-profit. I don't know what not-for-profit means. They're also profiting. And to approach that with a corporate solution and try to go at that with a layered VC-backed solution to take on a corporate mess doesn't work. And I kind of look at healthcare and how to navigate healthcare because we all know healthcare is a mess. Mm-hmm. Well, Medicare is a mess, we know, and we know healthcare is a hassle. And we've all experienced and touched it at some level. And again, maybe you not so much at a young person, at a young age, but let me tell you something, life is not a straight line. Mm-hmm. And I'm at the age where I got young adult kids and I got elderly parents. Just lost my mom to Alzheimer's this past year.
Sorry.
But his point is, 10 years of Alzheimer's and a week of hospice, God bless, but navigating healthcare, even for myself, getting blood work this morning for my elevated mercury because I've been eating too much tuna tartare at the Bell Harbor shops when I'm back home in Miami. Navigating healthcare is a hassle. It's hard. And so we look at it like David and Goliath. Like I know what Goliath is, but we're kind of like David. And I don't want to mix up the stories, but I know where the Achilles heel is now in Goliath. And we know how to approach it and tackle it. And it's not through, look, there's today, I feel humanism is the new capital. All people want, Ryan, today is this, what we're doing right now, having a direct conversation with attention, presence, listening, and focus, right? Tackling solutions and tackling healthcare and tackling navigating healthcare with technology and AI and apps and 800 numbers and layers and social angle. It's not as effective. The humanism piece of it, the high level of high touch doctor facing is how we're approaching navigating healthcare. And it's actually kind of why we're so selectively busy. And we'll talk more and share with people more about navigating healthcare in this talk, because there's two things we decided early on with the formation of this. Is one, we're going to share value on, say, LinkedIn as a chosen platform of whatever, higher bandwidth. Like we're going to share with people how to navigate healthcare, because if we don't share our decades of actual actionable clinical experience of what we do every day, it's almost criminal. And the second piece we decided is if we scale beyond being doctor facing, mm-hmm. if we scale beyond having a client household conversation, like this time of day, like we're recording this thing now, Then we scaled down the high touch. Our client households want.
Mm.
So talk more about that, and we'll share more value throughout this. And I'll share with you through this talk a few of the harsh realities to the healthcare system, and hopefully bring some value forward, and hopefully help people navigate a little bit easier.
Certainly. And that gives me a lot of different ways to go. But you mentioned leaving clinical medicine. Was there a moment or a phone call or a patient or a breakdown that led to that? Or was it a buildup of experience? You have an interesting point of view being a doctor in this interesting field.
Yeah. Well, let's be clear. I didn't leave clinical medicine. I'm actively practicing clinical medicine. I'm a gastroenterologist by training. I trained
Yes,
at the University of Miami. I've been doing healthcare for 3 decades, and I'm not leaving it. I love it. I'm good at what I do. I'm great at what I do. I'm saving lives, man, every day. And I'm doing colonoscopies and taking care of patients today. But I'm doing it under my terms. I'm no longer in private practice. I left my
yes.
partnership. I walked away from the equity of that, and I'm traveling now, and I'm working in different states, and I'll be in Colorado next week, and I'm in Georgia this week. So I'm still in clinical medicine. I'm still very much in the trenches and in the game.
Mm.
But the business itself, you asked me like, what inflection point, why did I decide to start this other company, and why did I see the need for it, and why is that business require my time and attention now the way it does? There's always, what's the driving force? What's it about? What's the thing that happened? I was getting grilled by a guy from Morgan Stanley, a New Yorker. Like, how's your business? Trying to get me like on my heels or get some ROI. And I'm from New York, so I could take it. But I said to him, after a long pause, I said, rewarding. He said, let me tell you why. I said, I've been in healthcare for 3 decades. My team's all in healthcare. We're really good at what we do. And I tell people the same thing. I'm like, we're not building your websites. We're not cooking a pizza. And we're not going to write you love poetry. All we do is move you, leadership board, select families, or your private individual family through the healthcare system with a very high degree of privacy and discretion, quicker, faster, easier, and better than most people you know. And yes, we have a business model, and yes, we get remuneration for what we do. But in the end of the day, our business is driven by one thing only. It's driven by service.
Mm-hmm.
So it drives us. When I got on a call with someone 2 days ago, I'm talking to someone at 7 p.m. at night, and they're in a dark, scary place. And I share with them 4 words. I don't take lightly. Put a lot of weight to these 4 words, coming from my place, sitting where I am in my shoes, and told them, you are not alone. It's a very strong thing to do. When you're the CFO or the ultra high net worth advisor or the trusted estate attorney, making that connection to your prospective or current client in a dark, scary place, you just bought generational loyalty. But you asked me what caused me to go there is service, serving people. We're helping people move through dark, scary moments of their lives. And, I was actually hiking up Ajax at Aspen a few months ago, and I was thinking to myself, like, geez, we're not miracle workers. Like, not. We don't fix every problem. We can't solve every problem. We don't.
Right.
We're highly proven in acute crisis intervention. We've become highly focused and effective in prevention and planning, preparation, which we could talk more about. But when I was thinking, like, we're not miracle workers, but we are the next best thing to it when someone's in that dark, scary place. And that's kind of really where we're at and what drives us and what our engine is, because it's something you may not have experienced. Like I said, you're younger. I don't know what your demographics of your listening audience actually is, but as I'm preparing a talk for Tiger 21 and I'm preparing to talk for some UBS group in Texas, the other day, just like, I got to put that in. That's like my first slide. Like literally the first slide now is winter is coming. Because I thought about it, Ryan, winter's coming for us all on some level. And the question I have for you, and the question I would have for anyone listening to this is, is it going to be a snow flurry for you? Or is it going to be a northeasterly hitting you on the back of the head like a tsunami? Like, how is it going to be for you? How prepared are you going to be? How are you going to navigate it? How are you going to handle it? That's the reality, because winter's coming for us all, man. I got to tell you something. You can watch all these longevity guys, and
the biohacking,
Tony Robbins and Life Force and Peter DeMontis, and I saw Peter T on, 60 Minutes the other day, and he looks great, and I love what they're doing. And Mark Hyman, let me tell you something. All these guys are looking older. Everyone's getting older. Like, it's the one race you're not going to win. Peter T, I'm really intrigued and really clear. I think it's incredibly intuitive to understand the difference between health span and lifespan. How long are you to live and what's the quality of life? What's the marginal decade? What's the last 10 years? the focus on exercise. You know, listen, as a gastroenterologist, I'm a GI. I don't know if I've told you, I'm a gastroenterologist by training, GI and liver disease.
Yeah.
One of my patients would ask me, like, what's the secret? There's no secret sauce here. Like, this is not rocket science. Balance, portion control, avoid white flour, avoid white sugar, avoid anything processed or in a bag. Well, now you get green, healthy stuff in a bag, but avoid processed food. Like, pretty simple. We know the 4 pillars of longevity: sleep, exercise, diet. And we know probably the most important pillar of that, or the 4-legged stool, or the important leg, is socialization. Relationships, however you want to look at it. I'm not saying socialization means having 1 million followers or likes on Instagram. Who cares? I'm talking about having like meaningful relationships in your life, whether it be with an intimate partner or with your kids or with your parents or with your friend or even with yourself. But those 4 pillars of longevity, the 4 horsemen Peter Thiel talks about. And I really, speaking of him, not because
Peter Thiel?
Peter Attia, not Peter Thiel's the
Tia.
money guy.
Okay.
Peter Attia, Attia. He was on 60 Minutes last week in early November. It was a very interesting segment. It's on YouTube and everything. But I'm speaking of him. He's a medical trained doctor. He was at Stanford, could be an oncologist, and left it. But it's not rocket science. I'm not going down the biohacking, blue light, red light, green light, hormones, peptides. Oh, I'm not talking about that. I'm talking about, keep it simple. Nutrition, balance, portion control, balance in all areas of your life, balance of your business, of your work, of your nonprofit, of your for-profit, of your exercise, more sleep. These are things I'm talking about. So we kind of went down the tangent, but if this is bringing value forward to the listening audience about things that matter most, this is kind of what our driving force is. This is what pushed me into the time and attention executive health navigation requires. This is why I'm so selectively busy, and we are so selectively busy in who we work with, and why, frankly, my time is so limited today.
So, and I appreciate that, Brian. I guess it's interesting. I know a lot of doctors. I've worked in biotech. I've helped raise money for a lot of biotech companies, public, which is very hard to move, especially nowadays. It's getting increasingly harder. And a lot of the founders, I would say about half and half, are doctors, successful doctors that go more into the venture direction, right? So doctors are interesting, especially going into the private markets, because you guys go to school forever, then totally sets you apart from, you finish, you get ready to practice, then you go into this network, right? And you don't really need to advertise. The network helps bring people to your door. Assuming everything goes well. I was just talking with somebody about this too. And typically you're set for life. So I want to know, you mentioned service. I know what you do now at Executive Health Navigation is very high service, high touch, and I understand your clientele, and we'll get there. But I want to know where you started to realize that, and everybody sees the disaster that is the U.S. healthcare system. Why did you want to go and risk it and do something else when you could have just rode till retirement and have success as a gastroenterologist?
So you're speaking the way I saw the world when I was growing up in Long Island in the 1970s and early 80s.
That's where I am.
Okay, so I was in North Shore, Long Island, watching my pediatrician, Milton Gordon, say I'm going to go out with my boots on, and probably died in the office. But, playing golf on Wednesdays and retiring at age 62 if they wanted to. Doctors and lawyers were doing very well. The world has shifted. There's been a seismic shift in the healthcare and legal industry, in the earning potential and the compensation models of most doctors and most lawyers and stuff. And yes, some do very, very well. Don't get me wrong. And I think, at the end of the day, I work with students all the time. I love when people are choosing healthcare. Why? It's a great profession. It's an honor. Helping people, we always can make money. You always can make 6 figures without blinking. I have more work than I know what to do with if I want to just do clinical work. I got 15 to 20 job offers every day in my inbox. But private practice in South Florida, I could throw a stone and hit 6 gastroenterologists.
Yes.
And then, more expense, less reimbursement, more overhead, less income. And gastroenterology for me, I love what I do, but it's a volume driven business. Like I'm going to be doing colonoscopies all day at 75 years old. Now I started thinking, like, how do I still serve and help people in a way on my terms? And I'm finding a very happy medium, which goes to balance. If you ask me, what's the one word that I would tell anyone, and what's the one secret sauce to living a full, invigorating life? It's balance. It's not about being the first one up at 4 a.m. and I'm going to run 5 miles on a journal, juice, meditate, do ice baths, and then, or, go kayaking, and it's only 6:32 in the morning. Like, no, I'm like, how many hours sleep do I get now every night? Like,
Yeah, that's exhausting.
I'm finding that balance. I was going like that for many years of my life. And
Mm,
now I'm like, I'm going for sleep. I'm looking at things with more balance in my life. And it's providing much greater clarity and much greater success in many, many different areas of my for-profit world, my nonprofit world, my relationship world, my own health world. Yeah. Knowing
mm,
that I'm 54 years old and knowing that winter's going to come for me too.
mhm, mhm,
I was telling my chief surgical navigator, chief of plastics, high-level academic institutions, and my chief medical advisors, Duke and Cornell trained, telling these guys, like, we're not growing our company to $100 million valuation in 10 years. Like, I'm not looking to grow this thing, pop it, have some big exit and get sick. Like, I see it every day, man. I'm not doing it. So we became really fixated on the right partners, the right families, and we're really obsessed, like compulsively obsessed with integrity-based relationships.
mm. So the perfect area to pivot into that direction, because now you've been working with some of the wealthiest families in the world. I notice too, where we come from, everywhere, people have an interesting, detached, dissonant opinion about how the ultra high net worth, the big families live. What's something from your perspective, having worked with some of these families and groups, what's something people would never guess about that world?
Yeah. I was talking to a very visible high net worth person who's very faces known in the financial space. Said to me, health is the great equalizer.
Hmm.
I'm talking about summer in Chicago. He's like, look, I can get shot on the street and it's going to take 19 minutes till the ambulance shows up and I'm going to bleed out.
Hmm.
You know, Tony Robbins has said it, but it really comes from a retired Delta pilot. I think a Delta pilot, and actually, and it's like, you don't want to be the richest man in the graveyard. That's another way to look at it. The best thing is I was shared by someone in the family office space, and I actually added it to our website because I loved it so much. It's an Indian proverb, and it really resonates home for me, and it resonates home for many of the people we work with because they all get it. You know, a healthy man has 1,000 wishes. An unhealthy man has one.
Hmm. Hmm.
So if you ask me, all the money in the world, all the things you have, all the freedoms, I mean, what matters most? What's it about? What's Warren Buffett leaving this planet with? What's Jeff Bezos leaving this planet with? What's Tim Cook or what did Steve Jobs leave this planet with? Nothing.
Hmm.
Zero.
That's right.
Yes, we work with extremely wealthy people. You know, one conversation, I had a guy who's like, we don't deal with price sensitive people much. And I was like, Mike, like, how much did you spend skiing in Deer Valley with your family of four last month for the week? Like, what would it cost you to go to Club Med with your wife next week? Like, what's your priority spending here? What are you doing?
Right.
Again, most people don't think they need us, so they need us. And then it's all like panic mode. And I was dealing with a case like that last week where I was like traveling between Wilmington, North Carolina to Charlotte, then flying to Denver. And I was on the phone with the family office, like, we need help. Our client, he's in Seoul, he's not doing well. And, the security details with him and they don't know what to do. And we jumped and we created a solution with our partner, a medical evacuation company. And we created a solution because we've seen it 1,000 times. We are experts at what we do. We know what correct is.
Right. Well, walk me into that moment. Someone's in crisis. They're scared. They're overwhelmed. And you get the call from the ER or from their hotel room when they're traveling. What actually happens next?
I'm just thinking what came to my mind immediately was a conversation I had with a friend of mine in Miami.
Okay.
Saw him yesterday. He just got back from MD Anderson, just got negative scans for his metastatic melanoma. He's a kiteboarder, great guy. But I remember the call about a year ago when he called me on a Saturday, finding out that little pea-sized thing on his chest came back being melanoma. I understand the cancer world because I diagnose colon cancer all the time on people when I do colonoscopies. I know what it's like when you say the can't see the cell and emotionally shut down. Like, you don't hear anything after that. But an actionable step for him on a Saturday, besides him calling me as a friend, but was within 30 to 45 minutes, I already spoken to the CEO of the Miami Cancer Institute, who actually just passed away himself at that time. But speaking to the CEO of a high-level cancer research center that's tied into Memorial Sloan Kettering in New York, and creating actionable steps over the weekend, getting him onboarded as a friend, because this is like, just called me and I created a medical history and summary for him, with him. So when Monday came and there was already appointments being set, and he was prepared. Everything was going prepared. So when he walked into the office, because let me give you one of the harsh realities, Ryan, to healthcare, and then
Mm.
I'll get into the ER call, because when it's on
Okay.
call, there's a few harsh realities to healthcare I told you I'd share with you today. I'm going to share you the first one. Hospitals do many things. They're not good at everything.
Hmm.
And a good hospital doesn't always mean you get a great doctor. That's harsh reality one. So
Hmm.
the other harsh reality is, and this is a fact too, and most people and probably most people listening to this are in a low status position in the eyes of physicians. I'm going to tell you exactly why.
Mm.
When I was in practice in South Florida for 20 years, like, you come to my office, you were waiting 3 to 6 weeks to see me. You came to my office, you stood in line holding records, you didn't know what they meant. You paid $100 copayment, you sat down and waited 20 minutes. After waiting more than that, they brought you to another room and you waited 20 minutes more holding records that are like Swahili or calculus to you. And then I walked in and it's like, hi, and I'm in a computer looking the other way, typing, realizing you don't know why you're there. I guarantee you, people that you're in your listening audience or clients of yours that go to board meetings, mergers, or acquisitions, go with extreme preparation. They know everything about the buyer, the seller, the market, the cap, the index, the deck, the slides, the pitch cold. Yet people come to the doctor's office all the time when the product on the table or their own agenda is their health without any preparation. It's the craziest thing. So we're highly fixated and focused on preparation and planning. And when we onboard a household, and why do we work with households, not individuals? Households. You're my client in New York and your daughter's at school in Boston. Or you're my client in Chicago and your mom's in Boca and she's got a broken hip on Saturday. Or your daughter is intoxicated with COVID or appendicitis in a car crash at 2 a.m. on a Tuesday. Who are you calling at Boston University Medical Center or Boca Regional East? I'm not calling anyone.
It's
I mean,
closed.
yeah, not closed. You can't get hold of an office manager in a week. We can get hold of most doctors in 12 or 24 hours.
Mm.
Oh, and I'll talk to you about the ER case
That
in a
is the
minute.
low priority, because unless you're another physician or in the space, I mean, even if you call CVS pharmacy,
Yeah,
right?
CVS. Yeah,
Press
yeah.
1 if you're a normal person, 2 if you're a doctor.
Boom, boom. Exactly. Know how to navigate. We saw early on the understanding that how you navigate the system, how the needle moves, how this works. And so that was like something that happened. It just came to mind because I spoke to him yesterday. But let me get an example. So speaking to a guy from UBS, one of these Barron's and Shook related, ranked guys in New York City, ultra high net worth advisor. And we tell you that world, and you know that world maybe. The first call comes to you when the roof leaks or the kid can't get into USC because there's a side door closed and they don't row and don't have Photoshop. So the advisor or the attorney is going to get the call. This guy gets a call from his billionaire client, goes to me, look, I got bowel obstruction. I got to go to the hospital, but I'm not going to go with anyone but you. So this guy leaves his wife, his kids, his friends at dinner, takes his client over to an Upper East Side, highly ranked hospital. I'm not going to name it, where his client was a donor, no less. And he goes to me, I'm sitting with a bunch of drunks at 3:30 in the morning.
Jesus.
I'll make up the guy's name. Like Ted. Ted, you call me directly next time. You have my mobile number now. You're going to call me personally. I'm going to tell you exactly why. I said, I'm going to speak to the ER doc. I'll speak to the triage nurse before you even get there. I'll speak to the ER doc within 30 minutes of your arrival. And you won't be sitting with drunks at 3:30. Because I don't care what CEO meets you in a lobby, puts you in a red carpet like Aladdin and walks you to the x-ray. The power of the conversation is me or someone at my level on the phone with a doctor in a reading room getting a real-time CT result, talking to an ER doctor who's got stroke in bed 5, heart attack in bed 6, and 2 traumas coming in the back door. That's how the needle moves. That's how the game's played. And when you're the CFO or the ultra net worth advisor or the trust and estate attorney making that connection to your prospective or current client, when they're in a dark, scary place, you just bought generational loyalty.
Mm.
We see it over and over.
And I love that phrase, and you've used it before. And you kind of killed one of my questions, which the follow-up to that was, what would you say to a prospective client that says, I already have a doctor? And I think you answered that pretty well.
And that's great. You need a doctor, and I'll be honest with you, our website recently got updated to say today there's a new normal. Today the new normal is like you need a concierge doctor to have a primary care doctor because our primary cares are getting boxed out. And I would say that the upper middle class, or I don't care how you want to classify them as rich, whatever, the upper middle class is getting boxed out because they don't want to be in an HMO. They don't want to be on a panel with 5,000 patients, yet they only go once or twice a year because they're relatively healthy and they don't want to pay 5,000 or 7,000 because they don't need it. So it's like kind of a gray zone, but that's the model. But I'll tell you exactly, I mean, as a specialist, concierge doctors in Miami Beach were coming to me like, look, I got so-and-so client, they're paying me $10,000 a year, but I can't get them in to see the specialist because
Mm.
this is another harsh reality to
So
healthcare.
you've said you're not concierge, right?
I'm going to tell you exactly why we dropped that word 2 minutes into the game years ago. That word concierge is up there with coaching and up there with now family office. These are diluted words. They're
Yes. Yeah.
overused and diluted. And I think family office is a currently diluted word. I've been joking with someone. I think the word collaboration is a diluted word because everyone emails me, I want to collaborate. But coaching got diluted. Tony Robbins was the first coach that got diluted to everyone. Lifestyle coaching, concierge is diluted. This is one of the realities to healthcare to understand is, what's a concierge physician? And you probably need one. You're probably going to get forced to get one at some level, but we're not concierge doctors. You want that? We'll help you find someone. You're going to pay $5,000 or $10,000 or $25,000 a year in New York City now to get a doctor's cell phone and a Z-Pack on the weekend. Like, we don't do that. And we're not doing telemedicine. You want to go to Teladoc or another service like that for $20, you'll speak to a nurse about your sniffles. And there are corporate entities who sell packages to navigate healthcare with
Like Pinnacle.
multiple offices, multiple doctors, dozens and dozens of nurse practitioners and social workers and layers, and an 800 number to create your solution with families on a pod with point systems. We don't do any of that.
Mm-hmm.
We're a very high touch tip of the spear group, as I mentioned, of a very few physicians that are very selective who we work with that are essentially been called medical sherpas and healthcare problem solvers. And we are a force multiplier, growth catalyst for ultra high net worth and financial groups and multifamily offices who realize that if they don't differentiate themselves today in this ultra competitive market, because everyone has wills, estate, trust, tax planning, security, and cybersecurity, and everyone's talking about Bitcoin, because if you're not, you're passe, because David Solomon and Goldman talk about it.
Mm-hmm.
Those in the world of ultra high net worth, wealth management, multifamily office advisory, high touch service offerings that are not discussing what we're discussing today. They're not talking about health today. They're not addressing this conversation now, are falling behind and losing market position.
Mm.
What matters more to people post-pandemic than anything else? And then this is what matters. This is sticky. And when you're in the multifamily office space or the ultra high net worth wealth management space, and we'll talk about C-suites in a second and why we work with C-suites and outside private individuals. But if you're in the space of serving these type of these families, and you're not bringing differentiation, or you're sitting across the table from a guy who's got 10 million cash, 100 million assets or whatever, try to hold his attention today for 3 minutes. Good luck. But private healthcare navigation catches attention. People are like, what's that? Everyone's got issues. Kids' seizures, kids' asthma, dad's dementia,
Sure.
their own prostate issues, their wife's breast lump. That's why C-suites have brought us in and put us on retainer. Because the first piece I mentioned to you was the currency we all speak today, Ryan. It's called attention. And if you can't hold attention or capture attention, you're done. That's today's currency. The other currency today is of vital importance is presenteeism. And I refer to that in terms of C-suites. C-suites, you got 5 people on a team, and on a good week, if everyone brings 70, 80% of their A game, you're in a good shape. But when someone's dealing with their wife's breast lump or their own tennis ball elbow or pickleball elbow, or they're dealing with their kids' seizures and they can't get to a pediatric neurologist for 3 months, you're coming in with 30% on a good day. So that's why C-suites have put us on retainer and helped us navigate for them when they're dealing with the leadership that's dealing with cancer and other things in their own lives. Because it's not only a business crisis, personal crisis, it's a business crisis. And I had a company going public that year that was about to lose 20% of his leadership team to cancer. Not lose them in terms of dying, lose them in terms of like, what do I do next? I'm like a deer in the headlights. What do I do? How do I navigate this? We were able to help them navigate through it, work from home, get treated, fortunately go into remission. The company didn't go public that year. They didn't go have the IPO, whatever it is, the market conditions changed, but at least kept the business, floating through the year. And otherwise would have been completely derailed.
And again, great point. I think you're right. I mean, at least in the family office purview, it's about succession, governance, estate, cybersecurity, but very few are talking about health and healthcare in the same breath. I know you're actively trying to change that. What are your thoughts about that?
How is G3, G2, G1 dealing with today's world when G2 is becoming in charge and G1 is starting to become less in charge or less cognizant or having early dementia or other issues? How does a family deal with that? How do you approach it? How does G2 run their family enterprise effectively when they're dealing with their kids' issues, whether it be a chronic skin rash or other things, or their wife's issues?
Sure.
How does legacy fall into place when there's no plan? It's reactive, like, the panic mode. we allow businesses and people to run their family enterprises and their family offices and their their multi-generational legacies because we help manage things that we are experts in. I'm not managing the financial piece of their business, the important piece of their business, keeping them
Right.
alive. It's real and it's today. And as people live longer, doesn't mean they're living longer quality lives. How does a family address things that need to be dealt with that maybe not aware of? What happens when your kids are 18? What happens with the legal stuff and the adults? What happens if dad's long-term planning? How do you approach it when dad's in Scottsdale and you're still in Chicago, or you're in New York and mom's now in Boca?
Sure.
Well, we're going to recommend, hey, you have an envelope by the door with EMS/911 written in big red letters with their advanced directives, their medication history, their summary, your contact information, next steps, who to call. And not only have it there, but have it with the concierge, have it with the local PD, fire department, the police department. Make sure there's a key to the front door. Because what happens when dad's got COVID and febrile, or falls and hits his head, or mom's feeling whoopy and she goes to the emergency room? Like, well, they're going to go to my chart? Like, you kidding me? These are things that we deal with all the time. Preparation and planning for what matters most.
And it's so interesting. And let's go on that more because we have a lot of family offices that I share this with that watch and I interview families. We just did our last interview was with a big family office from Chicago with Carol Lavin-Burnick. What are some of the emotional patterns or blind spots that you see wealthy families consistently overlook when it comes to healthcare? Because everyone's different, but I imagine there could be some repetition there.
I mean, look, healthcare is a big umbrella word for physical health, mental health, emotional health, addiction health, substance
Mm-hmm.
abuse health.
Mm,
There's so many layers of health we address now. And a lot of these families are challenged by the, I said the punishment, or I don't say punishment, the mixed blessings of wealth,
mm-hmm.
addiction, drugs, all these other things that come that we know. Mental health, anxiety, depression, social media, reputational health today. There's a million things that you
Sure.
think sideways, and we know life is on a straight line. Like I said, people are very reactive in this space. They're much more sometimes concerned about mapping out their portfolio in a stock market than they're watching their, you know, blood markers, or much more, fixated on certain things than they are fixated on things that really matter. And
Mm-hmm.
again, I'm 54 years old. I used to say I want to get to 50 in the best shape of my life. I'm now saying I want to get to 60 in the best shape of my life, because I'm realizing, this is the marginal decade getting to that position. There's a million, angles to look at it. But in the end of the day, it's pretty basic and pretty simple. We're all living here a very short time.
Mm-hmm.
You got to decide, things in your control and things not in your control. We tell people all the time, your health is not always your decision. How you handle it is, but how you handle it is. And I'm not up here preaching, like saying, oh, it's easy to go through chemotherapy. This is not, I'm not saying that. I'm just talking
Mm-hmm.
general big picture concept. Your health is not always your decision. How you handle it is. It's kind of really about what we're doing, the preparation and planning, creating a medical history and summary, having a medical history summary story. I did it for a young client yesterday, just onboarded their household. She
Mm,
has to end her period in a few months. Her blood work's off. Well, I'm able to take what she has and we put it through our clinical team. We looked at it, we cleaned it up. And when she goes to the doctors next week, when she's back home from college, it's going to be with a 2-page summary.
mm,
So the conversation is going to be, I was kind of saying, when conversations for us, when our clients go to doctors, this is like how, I don't know if I walked you through this yet, but this is how status changes. When a client of ours goes to a doctor, it's kind of like this, like, hey, Dr. Smith, or hey, Dr. Austin, nice to be with you today. I'm really, happy I was able to find time and be here with you. Look, I think Dr. Dooreck or his team gave you this, but here's my 2-page medical summary written by a doctor the way we want to see it, the way we need to see it. I know you're
how
going to
much time does that save?
I know you're going to examine me and ask me questions. That's great. But first, I just want to go over a few of the outcomes and results I'm looking for from today's meeting. This is what happens, Ryan. We sit on our chairs differently. We'll look at you differently. We'll treat you differently. This is part of the status frame and how we work with our clients. We show people how to navigate healthcare. It's not about a name. It's not about what doctor to go to. Oh, I got a name. It's not about a name. Like I said, hospitals do many things, but not great at everything. Just because you got a name doesn't mean it's the right doctor for you. It's not about a name. It's about, well, you're just and you're patient number 1 of 27 that day, or 1 of
Right.
50 that day, or 1 of 18, whatever it is. So it's not just about getting a name. It's about going with preparation planning, going with, conversations on a doctor to doctor level. Again, doctor facing is what we realize
Yes.
is the David approach to Goliath.
Mm.
It is why we are limiting our, business, and why in 5 years we'll close the doors. Like, we'll have 5 firms, family offices, multifamily offices. And I don't know if there's room on our block for one big flagship store on Fifth Avenue. I don't know if there's room for that one big name. And we talk to them all. I don't know. And I don't know. Everyone's gunning, competing to be the best in the Barons, whatever. But about 5 firms, about 10 or 15 private households. Because again, if we scale beyond the ability to be doctor facing, we scale beyond the high touch service our client households want. And we're becoming friends with our clients.
Right.
And that to me it's a 100-year mindset. I won't be here. They won't be here, but the firms, I hope to be there. Legacy of the families, I hope to be there. These are the things we're doing. This is why we're now including global medical protection and global evacuation with our families that be on board. Because
Oh,
having
wow.
dealt with these situations, like in Seoul for that client recently, I'm like, no, is no longer. I offered it a year ago. We gave it we went to our family, said, hey, we're going to give you this, but no one really acted on it. This year I insisted. Had my company call them, and we assisted. We got their information. We paid for it. We included it in their yearly engagement with us. And now they have a membership number, because you know what's happened? No one thinks they need you until they're like, I busted my knee skiing in Switzerland, or I'm traveling in here and I'm not doing well. Oh, no, I don't need it. I got the Amex Centurion card. Okay, great. Well, they're going to bill you $250, and then you got to file a claim. Like, no.
Yeah. You can't put that on your knee.
Yeah, like here's an 800 number. We have a special ops team, US based, English speaking. All they do is this stuff. This is a solution. Again, reactive approach, proactive approach, preparation and planning, what matters most.
I love that idea and understand the frustration you're talking about from the system. And I understand what you guys are addressing. And I like how you describe the work as doctor facing rather than product facing. I guess I imagine the challenges for you and trying to scale human connection and building trust, generational loyalty. How often do you get new clients, though, when they have a busted up knee or they're in the ER and they're like, a friend told me to call Dr. Brian Dooreck. Is that how you meet most of these new clients?
So I like the word scale, because I get grilled. How do you scale? How do you scale? And I'm like, look, man, we're not about more followers or likes or the clients, or we're not, it's like, we're about the scalability of trust. More trust, more service, more value, more privacy, more discretion. Like, that's it. Like, we are about the scalability of more value and trust. That's our scale. I'm not growing this business to $100 million valuation in 10 years. I told you, I'm not growing this thing to pop it when I'm 60 and get sick. Like, I see it all the time. How does it? Yeah, it's a lot of word of mouth. A lot of connectivity has been built through sharing on LinkedIn and just bringing value forward. I believe in bringing value forward comes awareness of that. Things like the Ultra High Net Worth Institute and Family Wealth Alliance, which we have joined to bring value forward. Not soliciting think tanks. It's kind of the way we look at it. Like the Ultra High Net Worth Institute is a think tank of people bringing minds together, not a pay to play model. That's where we're at. We just actually created a new line of understanding in our business. So we had to create something like for acute case engagement when we get those calls, and we get those calls all the
I would
time.
imagine they're frequent. Yes.
And we created something with a limited engagement to help people with emergencies. We don't have a family wide or an onboarded household. And we created in a model. And I thought about it, I was like, I don't know, man, when you're getting the call that the FBI is about to rappel down on ropes with Kevlar vests and, windbreakers saying FBI carrying Glock 22s, like, you're going to call your lawyer and you're going to be like, whatever, just get me out of this.
Yes.
So we're getting those calls all the time, and we no longer have a proof of concept that we have to proven concept over and over. We're hitting home runs every day. So it's like, so we have that line now, because I needed to create for us and direct a buffer for our team to have like a little bit more of a protection, because we want to help. And this is the situation. We get calls and we're inclined to help. We want to help people. We have to help people, but we also we have a limited amount of seats at the table, because we can't jump for everyone. And that's why we like to have firm-based relationships, because I know the calls are going to come to us on a Tuesday night or Saturday morning. Firms, ultra net worth advisors, multifamily offices that don't have a solution to this, that go to what they think is the norm. I got some clients who are doctors at the local hospital, or who do you know at the church or the country club or the synagogue? Who do I know on the board? It's dabbling. We don't dabble.
Well, I imagine, and I understand the difficulties of scaling when you're doing a really personal type of service that you're providing to clients. And I know you've been approached by a lot of larger firms and family office platforms.
Well,
What
I don't
makes you
see it.
say
I don't
yes? What makes you,
I don't see it as difficulty. I see it as a choice. I'm being born
what's your
into
filter then, Brian?
I'm going to tell you exactly. I'm being born into a conversation by a financial group that wants to create a family office for 5 families. These
Mm,
families are going to be 200 to 800 million in size. Had
hmm
a few calls, few meetings, and and they asked me to come on maybe as their chief healthcare advisor, their chief medical officer. And when I was in the conversation, they said, "What's the most important?" We got 2 or 3 meetings, CEO level board. What's the most important thing? I said, again, what I told you. Didn't take me long to answer because I tell myself this every day, and it reminded me, I tell my team quite often, like all people want, Ryan, I was telling you before, all people want today is this. They want direct human connection with presence, attention, listening, empathy, and focus. All people want today is this. This humanism is the new capital. I'm ready to go analog, man. I'll tell you, I'm ready to go analog. I mean, all this AI stuff, all this technology, our brains are not designed for it. All this technology, we are not about that. Humanism is what drives our business, the human connection. An email to a doctor from me has ended up in things like 8 a.m. email goes out to a phone call coming at 10 a.m. from a chief of department at Harvard, like, "Oh, sorry I didn't get back to you. I was out sailing in Martha's Vineyard. What's up? Oh, I'll be in clinic next Tuesday. Yeah, just email me back and we'll deal with it Monday." Human connection. So what makes us decide? I don't see scale as a problem for us because I'm not on some testosterone growth phase. You're not on some testosterone growth phase in this business. Like executive health navigation is not there to solve problems for the world. We're going to bring value to the world. We're
hmm
going to
hmm
share on LinkedIn, for example, on how to navigate. And we try to do that every day
Yeah, you're great with that.
because it's like, service to others. So Muhammad Ali said, service to others is the rent you pay for your time here on earth. It's what,
Mm.
it's what drives us. Service. I told you that early on. So I don't see the scale issue as a problem. What makes the decision? People. Who do we want to work with? Who do we want to be friends with? Who do we want to take a phone call from a Tuesday night or Saturday morning? As I said, who do we want to go to bat with to become lifelong friends with?
Mm, mm.
Who do we want to connect with? That's the filter. I don't know, people say, "Oh, I'm in the no jerk business," whatever, and no jerk policy, whatever, same thing.
I've
What
heard
we
that.
did is we structured our business to create a model as we evolve to like I said, and we're halfway to our endpoint, like halfway to where we'll be, like, and we'll close the doors. But we'll know at that point who's at the table with us because we created a model that we're okay to let go of people at the end of a year because we didn't price it on the tip of the market. And we know the market very well. And we know what what's out there and what the market demand is for what we do. And it's harder to let go when you're just pricing it so high. So we're really about the long-term 100-year mindset game.
And kind of coming back full circle a little bit to the earlier when you mentioned your experience and at the clinical practice, you left it, you're
Yeah.
doing this, going in this different direction, and you built something that's very private, high touch, intimate, personal. You carry a lot of trust from the clients of yours, the people in your network. What would someone close to you say is the cost of showing up like this every day? Your personal cost.
Personal costs. I mean, it is like the fuel in the tank. It is the energizing, driving force of gratitude and appreciation. And
You
blessed,
love it.
I'm passionate about it. If you haven't heard in the way I speak and we talk and what we share online and what we connect and what we bring forward. I mean, everyone's got their own driving force. Some people it's this, some people it's that. I mean, I know what drives me. Progress, serving, giving. My weak spot, my Achilles heel, according to my friend who's like a very successful lawyer, is like, your problem is you're too giving. That's kind of who I am. I can't change that. There's a reason why I was doing what I was doing in high school and volunteering with this and doing that and creating different projects and created nonprofits in Miami and in resume building for high school youth. Why I created a nonprofit in the colorectal cancer space, and all these things are on my LinkedIn. Like you can go to Get
Yes.
Hired Miami, you can go to coloncancer.support. Like I didn't create these things because there's some monetization or some win or some like or ego. It's because it just drives me. I'm excited. I like building things. And I like building things that help people. And so my personal cost, it's all positive ROI if that regard. What I have learned is better balance in my life at 54. that I
Mm.
didn't have maybe 10 to 15 years ago. And I'm continually progressing and learning better balance in my own life on many, many levels, personal and professional, health, physical, emotional, mental, relationships, for-profit work, nonprofit work, all these things. This is a much bigger conversation. We could spend hours on. You could charge me $300 on the couch. But the point is, this is the evolution of life at 54 years old that you're in your 20s or young 30s, whatever
30s.
you are, you look young. But the point is, when I was 30 something, I wasn't looking at the world the same way I was when I was in my 40s. And I'm
Hmm.
looking at my 50s. And I'm sure my 60s are going to be different. And God willing, 70s and 80s and 90s with health and with quality of life. So it is all very intentional, very selective, very thought about where the energy is being spent these days for me. There's a lot of distraction out there. There's an incredible amount of noise, and I'm getting better and better at filtering it out.
And I mean, thank you. That's a great answer. And I'm curious, and because I always hear different answers from this. You had 10, 20 years of experience being a doctor. I look back on, my career, 10, 15 years, and there are things that I'm like, I'm glad I took a left when everybody else was saying take a right or something along those lines. What's something you feel you did right early on in your career as a gastroenterologist, as a doctor?
Someone I once asked Steve Jobs, what was the most important thing growing your business? He said, you have to care. You have to really care. So one is I care. Two, I do today and we do today at Executive Health Navigation, what I've done in my own personal practice when I grew that practice from, I think it was like 2.4 million when I came into over 5 million of revenue, when I left it. But the point is, we deliver every day and over delivering. I mean, just to be here, I mean, we deliver and over delivering, period.
Mm, mm, mm.
Give, always over deliver, give more than you expect to get back in return. Focus on appreciation and gratitude, not expectation. These are all things I pulled from listening to so many different people over the years. Like some Tony Robbins, some this, some that. No one's my guru. I'm not addicted to anyone. I'm just like, just pull different things.
Yeah.
You know, Steve Jobs, was why I created my nonprofit and Get Hired, resume building. Wasn't that? I think Steve Jobs is a great guy. I heard he was an asshole. I don't know. But point is, I loved his attention to detail.
Yes.
And I knew as a business owner that if I had a resume with typos and misspellings and fonts with misalignment, I would never interview that candidate and they could be the best person for the job. And at that time I was thinking, what could I do to help an Iraqi war veteran? The answer, they can't do in 5 years what I do in 5 minutes in Google Docs or Microsoft Word. And I know the of a typo-free clean resume. So I created a nonprofit, Get Hired Miami, to show my
Mm,
kids there's more to it than just doing for profit and building my own business, building my own wealth. So, and when I heard Steve Jobs, say, what's the thing that mattered most in his business was you have to care. You have to really care. It's like, yeah, I get that. I really care. I'm only as good. So a doctor told me I was taking my first board exam. I was in a course in Georgia, and the 70-year-old doctor was there taking the boards for his own learning education. And I had lunch with him. I was right out of in the beginning of my fellowship at University of Miami. He took me to lunch and he said to me, I'm only as good as my last note. And I carry that to this day. I'm only as good as my last patient encounter, my last procedure note, my last consult note, you're only as good as the last thing you do in that regard. So we treat that same level of detail. If the little details are missed, the big details get missed too.
mm-hmm.
And we carry that in the work we do, especially in the work we do at Executive Health Navigation and working with patients. We're not flipping pancakes, man. This is like real deal, real stuff.
I got two more rapid fire-esque
Yeah,
questions
good,
to add too.
good. But
And
I gotta
thank you
go.
so much, Brian.
I gotta go save some lives here. I mean, they're waiting
Yeah,
on me.
absolutely. Well, then I'll keep
Let's
it.
rock
I'll
and
keep it
roll.
short.
No worries.
What's
Okay.
what's a belief or mindset that you let go of or outgrew?
Belief or mindset they let go of outgrew that you always have to be constantly busy. And it's hard for me still, but that rest and slowing the mind down are equally important, if not more important, to giving the mental clarity and energy needed to progress forward more effectively and to reach the outcomes and results of what I'm looking for in my life at whatever area it is, whether it be preferred, personal or professional.
And finally, what's your definition of a life well lived?
Progress.
Mm.
A life well lived is to me defined by progress and constantly growing, constantly moving forward. That's based on service to others. It's based on personal growth, professional growth, based on relationship growth, but it's all based on progress. And as long as I'm moving forward, as long as I'm progressing, it's where I find the most fulfillment and happiness.
Excellent. Thank you, Brian. I appreciate this. And where can people find you? And I'll put this stuff in the show notes as well. I know you're on LinkedIn.
Well, yeah, we're on LinkedIn. Executivehealthnavigation.com is our website. I mean, Google me, LinkedIn, whatever. I mean, we're not looking to be on Facebook and Instagram. We're not jumping up and down and we're not waving the flag. Where to be found is when you are looking for solutions, when you're looking for experienced professionals with expertise who have seen it 1,000 times and know what they're doing, when you're looking for people who know what correct is, when you're looking for high-touch doctor-facing solutions to navigating healthcare, that's where you find us.
Thank you, Brian. And like I said, we'll put this in the show notes. Thank you so much for joining me. And I think we might have to do a part 2.
Well, listen, I guys told you before, more important than anything, if you ever need anything for you or yours, call me directly. You have my mobile. Reach out to me.
Yes.
Here
Thank
for
you, Brian.
All right?
I appreciate it.
See you. Have a good one. Cheers.
You too.
Bye.
Thanks again to Dr. Brian Dooreck for joining me on Founders and Fortunes. If this episode gave you something to think about, share it, subscribe, and stay tuned. We've got more conversations coming that sit at the edge of health, trust, capital, and long-term decision-making. You can learn more about Brian's work at Executive Health Navigation, and as always, you'll find the links and highlights in the episode show notes below. Thank you again, and catch you next time. Bye.